Hello, and welcome to today's episode of The Health Factor. Today, we'll be discussing novel treatments of obesity and diabetes. So, why are we even concerned about this? According to the American Diabetes Association, 11.3% of Americans had diabetes in 2019. And according to the CDC, 30.7% of Americans were obese in 2017. So, today with me, I have a group of experts on obesity and diabetes to discuss the background of each of the diseases, true treatment options, ethics, limitations, and future directions for discovery. I'll be discussing what diabetes is and the connection to obesity, and then my team will talk about the rest of the topics. So what is diabetes? Type 1 diabetes results from the destruction of insulin-producing beta cells. This results in increased levels of glucose in the bloodstream, resulting in hyperglycemia that can be diagnosed by taking fasting blood sugar. Type 1 diabetes is extremely common in children and adolescents, and one of the most common treatment types is insulin replacement therapies. Not much research has been done on the link between type 1 diabetes and obesity. However, a recent study proved that insulin replacement therapies cause increased weight gain, which could result in obesity. So what is type 2 diabetes? Type 2 diabetes results from the inability to respond to insulin. In other words, insulin resistance. This is due to a defect in the recognition pathway. Cells that are supposed to recognize insulin are incapable of it, and this results to an increase in glucose in the bloodstream. Genetic factors coupled with environmental factors, such as lifestyle, result in type 2 diabetes. Obesity is one of the strongest risk factors for type 2 diabetes. Metabolic abnormalities that result from obesity can cause insulin resistance, which may result in type 2 diabetes. Leptin is a hormone that controls appetite. A reduced leptin response and a reduced insulin response can result in increased weight gain and type 2 diabetes. Physical activity, which is a lifestyle intervention, increases glucose uptake up to 40% and can reduce your chances of developing type 2 diabetes. It also reduces intra-abdominal fat, which is an risk factor for developing obesity. Now I'll hand it over to Dr. Krishna to talk about obesity in detail.
Now, our team of researchers here have discovered more about obesity and what makes it prime to a novel treatment option. Obesity is a condition that is characterized by having an excessive accumulation of body fat. It is typically defined as having a body mass index, or BMI, of 30 or higher. BMI is calculated by dividing an individual's weight in kilograms by their height in meters squared. However, BMI is not always an accurate measure of body fat, and other factors such as waist circumference and body composition should also be considered. Obesity is a major public health issue, primarily because it's associated with numerous health problems. These include an increased risk of heart disease, stroke, type 2 diabetes, certain cancers, and other chronic diseases. Obesity can also lead to psychological and social problems, such as low self-esteem, depression, and social stigmatization. The prevalence of obesity has been steadily increasing worldwide over the past few decades. In the United States alone, for example, the prevalence of obesity among adults has more than doubled since the 1970s, with approximately 30.7% of people in the US classified as overweight. There are many factors that contribute to the development of obesity, including genetic, environmental, and lifestyle factors. For example, some people may have had a genetic predisposition to obesity, while others may be more susceptible due to environmental factors, such as living in neighborhoods with limited access to healthy foods or safe spaces for physical activity. Lifestyle factors such as a sedentary lifestyle, unhealthy eating habits, stress, and even lack of sleep can also contribute to obesity. Effective strategies that are currently in place for preventing and managing obesity include promoting healthy eating habits, increasing physical activity and awareness of the effects of physical activity, as well as addressing underlying environmental and social determinants of health. In conclusion, obesity is a complex and challenging health issue that requires a concerted effort from all of us. By working together, we can create a healthier and more prosperous future for ourselves and for generations to come. Now, our team of physicians will discuss some novel treatment options related to treating type 2 diabetes and obesity.
Hi, I'm Dr. Nieto, and I'm here to talk about treatments for obesity. Obesity is a very complex issue, which sometimes requires further medical intervention than just diet and exercise. This might be the case for patients with a BMI of over 30 or of over 27 if they also have a second obesity-related disease. We now know that the brain is what controls satiety and hunger in the body. specifically through the ventromedial hypothalamus. Knowing this, there's actually only one medication that's FDA approved that works for obesity that doesn't exert action on the brain, and that's orlistat, which was approved 24 years ago. More recently, however, there's been a new class of drugs that's been developing called GLP-1 receptor agonists. GLP stands for glucagon-like receptor or glucagon-like peptides, and agonist means that it mimics that. So these are medications that mimic the receptors that stimulate the production of insulin. As you might have guessed, this has been used to treat type 2 diabetes, but it's also seen great results for obesity. It delays gastric emptying, which means the patient will feel full for much longer. It inhibits glucagon release, which means that it'll decrease blood sugar in the body, and it also decreases appetite on a cerebral level, though this mechanism is not as well known, but it has been proven to decrease appetite. Of the 7 FDA-approved GLP receptor agonists, 2 are currently approved for obesity. Liraglutide was approved in 2014, and semaglutide was approved more recently in 2017. Semaglutide is seen to have maybe better and more effective results for weight loss, but it also has been seen to have more side effects. So it really depends on your specific body and what your doctor recommends for you.
Hi, I'm Dr. Nguyen, and I'm an endocrinologist studying diabetes. One novel treatment for type 2 diabetes that we have been using is SGLT1 and SGLT2 inhibitors. SGLTs are sodium glucose co-transporters. These control reabsorption of filtered glucose from the kidney into the bloodstream. SGLT2 inhibitors reduce blood pressure and increase glucose loss through the urine. This causes weight loss within 12 months, and this weight loss typically continues for over 2 years. Some side effects of this are inflammation, increased chance of UTIs, dizziness, and hypotension. Some examples are dapagliflozin and canagliflozin. SGLT1 inhibitors, on the other hand, are less widely used because they're thought to be less efficient in glucose reabsorption. However, research with knockout mice recently has shown reduction in FPGs, PPGs, and A1C levels using SGLT1. Combining these two with combined SGLT1 and SGLT2 inhibitors are not as popularly used, but looking into the future, these could be more advantageous. They increase urinary glucose excretion, delay intestinal glucose absorption, increase GLP-1 levels in circulation, and decrease FPG.
Adding up to the conversation about all of this treatment for obesity, as a medical physician, I would like to discuss the ethics that arise with all of this treatment and with the condition of obesity itself. So unfortunately, it is well known that there's a prominent stigma about diabetes and obesity, which can lead patients to suffer from psychological abuse while seeking treatment. According to a paper written by the Committee of Ethics on the ethical considerations for the care of patients with obesity, obesity is a medical condition that significantly increases the risk of various medical outcomes throughout patients' life. Additionally, as described by Patricia Pace in her paper's Ethics of Obesity Treatment, this treatment is considered a major business in the United States with a high focus on weight loss programs, but research continually shows that failure rates are extremely high for all these types of programs, and there's increasing evidence that the programs can cause physical and mental harm to the patients themselves. One of the main issues is that due to unethical negligence from some of the specialists, treatments are often designed too broad and unspecific, missing the specific needs of each patient. As a result, specialists often face the challenge of reevaluating standard arsenals of weight reduction tools and developing treatments that actually meet the real needs of the patients. These include screening potential patients for health status in order to set a reasonable weight goal based on personal and family history rather than just height and weight tables. and placing a high priority on helping patients maintain the weight loss. So all of these treatments should consider the ethical aspects on the effects of the patient's lives, as well as keeping in mind that there's still unethical and unprofessional behaviors towards patients from some specialists.
Hi, my name is researcher Arnold Mayer, and I'll be going over the limitations and future outlooks of the treatments discussed earlier in this presentation. So while the medications and inhibitors mentioned as treatments can be effective tool for combating obesity and diabetes, there are some limitations to their uses. For example, Orlistat can cause gastrointestinal side effects such as oily or fatty stools, diarrhea, and abdominal pain. These side effects are unpleasant and can lead to treatment discontinuation. Additionally, GLP-1 agonists have limited efficacy. This method is also shown to help with modest weight loss, but the weight loss achieved is generally less than with other weight loss medications. And additionally, studies have shown that the weight loss achieved from this method is not sustained over the long term. Lastly, SGLT2 and SGLT1 to treat diabetes has not been studied for the long-term effects and may not be suitable for everyone. And overall, these methods may not be appropriate for people with certain medical conditions or taking certain medications. The future direction of obesity and diabetes treatment is likely to be a more personalized and holistic, with a focus on precision medicine, behavioral interventions, technology-based interventions, community-based interventions, and pharmaceutical interventions. These approaches aim to address the complex interplay of genetic, environmental, behavioral factors that contribute to these conditions. According to a review published in Diabetes Research and Clinical Practice, precision medicine and technology-based interventions may have significant potential in the future to prevent and manage diabetes. Additionally, community-based interventions have been shown to be effective in reducing the incidence of obesity in various populations, according to a review published in the American Journal of Public Health. Finally, pharmaceutical interventions for obesity and diabetes are constantly evolving, with new drugs and combination therapies being developed to improve safety, efficacy, and minimize side effects, as discussed in another published review. In conclusion, diabetes and obesity are growing problems in the US and all over the world, where researchers are working on novel treatments to combat these issues, and the goal is to develop a safe and effective method to treat these diseases in the near future.